Welcome to the channel Nursing in Handy. This channel is preferably for the nursing fraternities to have a continuous learning in the profession. So today we will be seeing about growth and development of infant. So infancy is a stage that starts from 28 days to end of 1 year. That is known as infancy stage. So during this infancy stage there will be a tremendous increase in the fine motor skills, gross motor skills, and they will be having a development of the a mnemonic, that is IMPES. That in IMPES the I stands for intellectual development, M stands for moral development, P stands for psychosexual and psychosocial development, and also play development in the child, and E stands for emotional development, and S stands for spiritual development. And apart from this theories of growth and development, we will also have a nutritional deficiencies in the babies, and also they will have a need in the infant. So as nurses we must know the normal growth and development of the infant. So once we know the normal growth and development only, we can able to identify if the baby is having any deviation from the normal pathway of growth and development or not. So only as a nurses we must have a knowledge, and also we must impart the knowledge to the caregiver regarding the close monitoring of the child of this growth and development. So the caregivers will be asking frequent questions regarding the weight, height, that means length of the babies, either it is in a normal value or not, whether the baby's milestone is achieved or not. Like that they will be having various questions, so due to their role in parenting. So as a nurses we must educate them regarding the normal growth and development, and what all will be the normal development that is seen in the infancy period. So when does the head control will take place, when does this reflexes will take place, and if the reflexes is flagging, at next what we have to do, we have to consult the pediatrician regarding this, and also we have to check whether the baby's milestone is attaining in the normal level or not, whether the baby is following the simple instructions or not, and also we have to assess the language in the babies, whether the baby's expressive language is there or not, or receptive language is there or not. So based on that we will be identify the growth and development of the individual. So growth is a term which is being is a measurable term that is being measured. It is a quantitative term, whereas a development means it is a functional maturity of the child. That means it is a maturity in the functions and also ability to do the work or potentialities, and it is a qualitative term. It cannot be measured like a growth. How we measure is like in growth we will be measuring kilograms, pounds, inches and centimeters, whereas the development cannot be measured. So introduction. The growth denotes an increase in size of an individual due to an increase in the number and the diameter of the cells, and development denotes functional maturity of the child. The growth and development are not synonymous, but they are assessed simultaneously. The growth performance in a child should be coupled with assessment of the development to get an idea of the child's performance in overall growth. So how the baby is able to perform the particular task, and also the growth is something which can be assessed and which can be measured. That means it is a quantitative term, that it can be measured in kgs or centimeters, whereas the development is not like that. So growth refers to an increase in size or in mass of the tissues. It is largely attributed to multiplication of cells and increase in intracellular substances. It can be measured in inches, centimeters, kilograms and pounds. So it is a quantitative term. So we can measure it. For example, one baby will be 3 kgs or 4 kgs. So like that we can measure, and we can compare it with the normal growth and development chart. So development, it simply specifies maturation of functions or physiological maturation. The term development is used to refer progressive increase in skills and capacity to function. It is a quantitative change in child's functioning and difficult to measure. Development is a result of maturation and learning. So with the increase in the learning process and due to the maturation, increase in the maturation process, the baby will have a development. So development, it mainly takes place due to the maturation and learning. For example, the baby will not be behaving same as like that of when the baby is behaved in first standard and when the baby is going to behave in the 10th standard. So there will be a difference in their development due to their learning and maturation. So next is maturation, is an increase in competence and ability to function at a higher level depending on child's hereditary. It refers to unfolding of human potentialities or hereditary traits which are carried by the parents. So in some ways the babies will be very potential in doing some activities. So one of the baby is very much potential in doing the dancing or sports. So this maturation is being carried out by the hereditary traits. Maybe their parents will be well versed in the dancing, or maybe their parents will be well versed in the studies or sports. For in that way the hereditary trait is being carried out to the offspring, and the offspring, that baby also perform the same maturation level in particular task. So next we'll see the particularly about growth. So growth is a quantitative. Growth comprises of height, weight, size and shape of the body organs. It is due to the cell division. Growth is not for a limited period. Growth can be measured. Growth tells one aspect of personality but in a limited scope. So it is a quantitative term. It can be measured. It can be measured like height, weight, size and shape of particular body organs. And also these growth mainly takes place due to the cell division. So we all know cell division being takes place in our body. So based on that there will be a growth in the individual. So each and every growth and growth of a person is different. So some will have a drastic growth, some will have a delayed growth, some will have a different patterns of growthing. So but the principles of growth and development is same. That means the cephalocaudal and proximodistal, and from center to periphery the growth will takes place, and simple organ will develop first, then the complex organ will develop, like that. This is the principles of growth and development. Next is development. It is a quantitative as well as qualitative term. In this the physical changes, cognitive, social and emotional change is also included, whereas in growth these all is not included. But in development the cognitive, emotional change is also included in development. It happened to motor and adjustmental process and their interplay. Development takes place till death. It can be observed by matured behavior. Development deals with all aspects of personality and a vast scope. So when we compare between the growth and development, the growth is a quantitative, development is both quantitative and qualitative. The development takes place till we go to the graveyard, and also the growth which comprises of cognitive, social and emotional change. So next we are going to see the stages of growth and development. So prenatal period, the embryonic stage is considered from the conception to 8 weeks. So fetal stage is considered from the 8 weeks to 40 to 40 weeks. 8 weeks to 40 or 42 weeks. So infancy, neonate from birth to end of 1 month. So specifically up to 28 days it is considered as neonate or newborn. So infancy from 1 month to 1 year. Early childhood, that is a toddler period from 1 to 3 years, and preschooler is 3 to 6 years. School age is considered from 6 to 12 years, that is middle childhood. And we also divide it into late childhood, that category is a adolescent. Approximately the age group between 13 years to 18 years. So for this population only we are going to assess the growth and development from neonate to adolescent. So even the adolescent are also again classified into early adolescent, middle adolescent and later adolescent. So definition of normal infant, it is the period which starts at the end of the first month up to the end of the first year of age, that is between the 28 days to 1 year. So infant's growth and development during this period is very rapid. So when we see like first month there will be one development, again in second month they will have a even more developed stage, and in third month even more developed stage, like that. So physical development of infant, the normal temperature is 36.5 degrees Celsius, the pulse is 110 to 150 beats per minute, and respiration is 25 to 45 breaths per minute. Blood pressure is between 80 by 60. So systolic can be plus or minus 20 and diastolic can be plus or minus 10 mm of Hg. And length or height is from till 6 months there will be increase of 2.5 centimeter per month. For 7 to 12 months there will be increase in 1.5 centimeter per month. So the normal weight formula is age in month plus 9 whole divided by 2. So this means that if we want to identify the normal weight of a particular age of the baby, we can apply that values in the formula and you can identify the normal weight of that month of the baby. Next is head circumference at 6 months 1.5 centimeter per month, and next 6 months there will be increase of 0.5 centimeter per month. So chest circumference, if we consider the 1 to 2 centimeter less than the head circumference during the birth. So after the baby attains the 1 year, the head circumference and chest circumferences synchronizes and they have a equal in length. So when the baby is born, the head circumference will be greater about 1 to 2 centimeter than the chest circumference. So once the baby attains 1 year of age, the head circumference as well as the chest circumference equalizes in a same number due to the fusion being takes place in the skull and head. So that is the physical development of infant. From the biological development, we have various biological developments, that is vital signs of the babies. So you cannot consider the vital signs, and there will be a difference between the vital signs in each and every age group. For infancy it will be different, for toddler it will be different, for preschooler it will be different, for adolescent it will be different, and for adult it will be different. So based on the age group, the biological development will differ, and also we have to know the normal biological development for each and every age group, then only we can identify the normal pattern. Next we are going to see the reflexes. So first is eye reflexes. In eye, the babies will have a blinking reflex and doll's eye. So blinking reflex means the baby will blink their eyes while they are seeing a bright light or a sudden noise is made near the baby. The baby will open and close the eyelid. That reflex is known as blinking reflex. Next is doll's eye. That means that we have a ability to move our eyeballs and see to the right extent and the left extent, and we can see that either person is coming or any object is coming. But whereas the babies cannot see like that. If they wanted to see any object or their caregiver is moving from their visual acuity, they will turn their head towards the person and they will see. So they are not able to change their eyeball from one place to other. That means they cannot shift their eyeball from one place to another. So next is nose reflex, that is glabellar reflex and sneeze reflex. So in glabellar reflex, when we are touching on the forehead, the baby will exhibit a reflex, that is a blinking reflex. So when we touch on the forehead, the baby will exhibit blinking reflex, that is known as glabellar reflex. And also sneeze reflex, that means the baby will sneeze when the nasal passages are irritated. So as of same that's that of adult also. When our nasal airway is being irritated, we will do a sneezing reflex. The same way the babies will also exhibit a sneezing reflex. So this all are the nose reflexes. Next we are going to see the mouth and throat reflex. So first is rooting reflex. So rooting reflex means when the side of the cheek is being stroked, the baby will turn towards the side where the stroking has taken place. Whether we are stroking on either side, whether left or right. So on which side we are stroking, the baby will turn their mouth, they turn their head towards that stroking side, thinking that the baby is going to receive a feed from the caregiver. That rooting reflex is followed by the sucking reflex and swallowing reflex. That means the baby will turn towards the side where the stroking has taken place, that means left or right, and they will start searching for the feed and start sucking the feed from the caregiver. So followed by swallowing reflex. For example, the mother is going to give the feed, means the baby will turn towards the place where the feed is available by rooting reflex and doing the sucking and swallowing reflex. Next is yawning reflex and extrusion. So yawning reflex is when there is a oxygen deprivation in the body will automatically exhibit a yawning reflex. Next is extrusion, means whatever we are keeping on the mouth of the baby will project out with the tongue, and they will project out whatever the particles we are keeping on the tongue or the mouth, the baby will project out. That is known as extrusion. So this is the difference between the yawning reflex and also extrusion. Next we are going to see the coughing reflex. That means that the baby's airway, when it is stimulated, the baby will automatically exhibit a reflex, that is coughing reflex. So this is the mouth and throat reflex. Next we are going to see the other reflexes in the body organs. So till now we have seen the reflexes in the eyes, nose and mouth and throat. Next is extremities reflex. First one is palmar grasp and second one is plantar grasp. So palmar grasp means when we are holding the hand on the palm of the baby will tightly close their palm and hold that particular object. That is known as palmar grasp. They will grasp the object in their palm and hold it tightly. So plantar grasp means they will hold with the help of the fingers of the toe. For example, if we are placing our hand or any pen on the fingers of the toe, they will close their fingers and they will hold with the help of toes. Next is Babinski reflex. It is a normal reflex in babies and children up to 2 years of old. It occurs when the sole of the foot is firmly stroked, causing the big toe to move forward and other toes to fan out. That means that the Babinski reflex, the babies will exhibit this normal reflex. If this reflex has been exhibited on the adult period, it is considered as abnormal due to some neurological deficiency. The adult will be exhibiting this Babinski reflex. Whereas for the infant, it is a normal reflex. There will be a movement of, that is upward movement of the big toe, and other toes will fan off. Next is mass reflexes, Moro reflex and startle reflex. In both Moro reflex and startle reflex, the baby will exhibit the same response. In Moro reflex, when we are holding the baby in a certain height, when we are just leaving the baby from a certain height, the baby will exhibit some jerking movement. In the same way, when the baby is lying down and when we are making a sudden noise in front of the baby will exhibit a jerking movement. That means the spreading out of the arms and legs. That is known as startle reflex. So when we make a sound and jerking movement is exhibited, that is startle reflex. When we are holding the baby at a particular height and we are just making a small making some movement of the baby will exhibit a jerking movement. That is known as Moro and startle reflex. So next mass reflex is crawling reflex and dancing reflex. So crawling reflex is once the baby attains the 7 month of age, the baby will be able to move forward by both upper extremities and lower extremities and have a movement. Dancing reflex means the dancing reflex is also known as walking or step reflex. It is an involuntary movement that occurs when a baby is held upright with their feet on a solid surface. So when we are making the baby to stand on the solid surface, the baby will make a movement. That is known as dancing reflex and stepping reflex. So next we are going to see the milestones of the baby. So first month is social smile. So when a caregiver, when they are smiling on the baby will exhibit a social smile. The baby will smile on others and till 1 month they will be taking the feed and sleeping, again taking the feed and sleeping. By 1 month they will start smiling. And second month is coos and vocalizes. That means they will make some sounds. That means which is not at all meaningful, but they will make some small sounds and they will and also they will do the vocalizers. Next is third month is head control. So till third month we will do the support of the head while holding, and again in third month they will have some head control, and fourth month they will have a hand control. Fifth month the baby will turn over. That means when we are placing the baby in the supine position, the baby will turn to the and they will turn toward the abdomen, and that is known as turning over. By fifth month the baby will turn over from the supine position to prone position. In seventh month the baby will make a crawling movement, and eighth month they will make a movement with the help of hands, that is known as creeping. Next is ninth month, stand with support. So if a caregiver is holding their hand, the baby will be able to stand, or they will be holding the table and standing. Next is 10th month, walk with support. So when a caregiver is holding their hand and making them to walk, That is known as, in 10th month they will walk with support. In 11th month the baby will stand alone. So without any support the baby can stand alone for a particular period of time. Then 12th month the baby will start walking by their own. Next is gross motor skills. So in motor development we have gross motor skills and fine motor skills. In gross motor skills, that is use of the heavy muscles to perform any activities. So in first month turn the head to side when prone, and in second month hold the head erect when held upright, and in third month hold head erect and steady, and in the fourth month the baby will hold the head erect and the shoulder by the degree of 90-degree angle and see on other people by placing on the abdomen. That means that by third month the baby will establish a head control. So in that way the baby will hold their head in erect position. Fifth month rolls from back to front. So from supine position to the baby will turning to the prone position and just watching on others what they are doing. Next is sixth month, the baby will sit with support. Either we have to place the pillow and the baby will sit, or sitting on the lap of the mother. That is the sixth month. And the seventh month roll from back to abdomen and crawl. So fifth month they will only turn from supine to prone, whereas in seventh month they will make a movement, that is crawling. And in 8th month sit alone steadily. So for particular period of time they can sit steadily without any support. Next in 9th month again same, stand with support, and in the 10th month walk with support. That means if the caregivers are just holding their hands, they will be able to walk with the help of the support of their caregivers. Next is 11th month again stand alone, 12th month walk alone. Next we are going to see the fine motor skills. That means the small muscles is being used for the activities. That means fingers. So first month hold hands in tight fist, and second month the hands may be open. And next fine motor skills in the third month is hold hands in front of face and stares at them. And in fourth month brings hands in midline and place with fingers. So that means that they will be holding the rattles. So by seeing this video you will be able to understand the baby is holding the rattle or the teat in their hand, and they are just staring at them and tries to just keep it on their mouth. That is next fine motor skills of third month and fourth month. So in third month they will be staring at that particular object, and fifth month they will be making a movement. Next in fifth month hold a rattle, and sixth month begin to transfer object from one hand to another. So if in sixth month and all, what happens is if you are giving the rattle in left hand, then after some time they will hold they will change the rattle to the next hand, and that is vice versa. If you are giving in right, they will hold in left. If you are giving in left, they will again change to right, that is vice versa. Next is seventh month hold a feeding cup, and in 8th month eats a finger food and drinks from cup. So in the 8th month only they will develop a pincer grasp. So during that time we can give the finger food to them, like we are cutting the carrot or just making cubes of the potatoes, or any vegetables being cut into cubes and giving together to them, or egg if you are giving means you can make it into a pieces and giving. So we can start the finger food by 8th month, because they will develop the pincer grasp during this month, so that we can give, and also they can hold the feeding cup. So we can give the tumblers to the babies to drink by their own with the assistance of the caregiver. So next is 9th month picks up the objects from the toys boxes. Next in 10th month release the objects holding it. So in 9th month they will all keep collecting all the objects from the down, whereas in 10th month what happens is they will just release the objects what they are holding it in their hand. Next in the 11th month takes the toys out of box. So they will be having some toys box, no, from that they will be picking up the toys and using it. Next, psychosocial development is by the Erik Erikson. That means a sense of trust versus mistrust, a complete dependence on the caregiver. The baby will trust only the person who gives the care to the baby, either mother, father, or the family members like grandparents or grandfathers. So whoever the baby sees in a daily basis, the baby will have a trust towards that person. If suddenly somebody or neighbor is coming to the home, the baby will not go to that person, because they do not have any trust over the person who sees them in a new time, or for the first time if the baby is seeing, the baby will not have any trust. So the complete trust on the caregiver is known as sense of trust versus mistrust. Next is psychosexual development by Sigmund Freud, that is oral stage, need for sucking pleasure. So whenever the baby is having a free time, or the baby feels of hungry, or the baby wants to give some information, the baby will put everything in the mouth, that is known as oral sucking pleasure. Next is spiritual development by Fowler, that is undifferentiated feeling of trust, warmth and security from the foundation for the later development of faith. So in the infancy period itself, the parents will be telling them, like they will be making a sound on the bell and asking the baby to hold the hand and bow, and they will know for what purpose they are doing it, but whenever they listen that music, they will do that same practice. So if they are seeing the candles, they will be making a kneel down. So that is known as undifferentiated faith. For no reason they will follow it. Next is intellectual development by Jean Piaget, that is sensory motor for 0 to 2 years. Moral development by Kohlberg, that means pre-conventional morality stage 0, that is unable to understand what is good and what is wrong. That means whatever the baby likes and whatever the baby want, that is considered as good. If a baby don't like and don't want, it is a bad according to the baby. So that is known as pre-conventional morality stage 0 for the age group of 0 to 2 years. Next is language development. The language is again divided into expressive language and receptive language. So expressive language means the baby will respond to the human voices. For example, if a mother's voice is being heard, the baby will smile and giggle and make some sounds. And receptive language means the baby will, whatever that happens to the baby, if the baby is feeling hungry, the baby will cry. If the baby is feeling uncomfortable, the baby will cry. If the baby is having a wet diapers, the baby will cry. That is a receptive language. So whatever the uncomfortable or the signs or any signal that baby wants to give to the caregiver, the baby will cry. That is a receptive language. Expressive means the baby will respond to the human voice accordingly. If a mother is making any laughing expressions, the baby will giggle and laugh. If a mother is making some harsh voices, the baby will start crying according to the voice of the caregivers. Next is play by Newhall, that is solitary play. That means the infants can play alone for a longer period of time. That is known as a solitary play. Next is nutrition. So as per the recommended dietary allowances, the baby has to fulfill these kilocalories in a daily basis. That is calories, they should contain 120 kilocalorie per kg per day. Protein 2.5 to 3.5 gram per kg per day. Fat 4 to 5 gram per kg per day. Iron 10 gram per kg per day. Calcium 400 gram per day. Vitamin D 400 international unit per day. Fluids 120 ml per kg per day. So these are the normal recommended dietary allowance for the infancy period. Next is health problems. So what all health problems can occur for this infancy period is falls. Why falls? Because at 1 year of age, the baby will start walking. Since they are walking, they will not have a steady gait while walking. So there is a chance the baby will go into falls. Next is suffocation. Next is aspiration or swallow foreign bodies. So when they are playing with the toys, if the small body parts from the toys is being detached, there is a chance the baby is taking those small toys and putting on their mouth. That will end up with aspiration or foreign body aspiration. Next is near drowning. Burns, so they don't foresee the dangers of burns. So sometimes what happens, due to their enthusiastic behavior and excitement, they will go and touch the hot waters or hot utensils, hot food, like that. They will end up with scalds and burns. Next is poisoning. Maybe due to the carelessness of the caregiver, or the baby have a fine motor development, the baby will open the bottles and sometimes they will drink, or due to the improper storage of the chemicals or toilet cleaners, the baby can open it and maybe they can drink and end up with poisoning. Next is motor vehicle accident. So they don't foresee the dangers of the motor vehicle accidents. They will be running in the grounds. When we take the babies out, they will be making running movements. So that time also it may end up with the motor vehicle accidents. So this is all about the health problems of the babies. Mainly they will go for the falls, foreign body aspirations, near drowning. So near drowning means if the water is being stagnated in the bucket, the baby may go and play in the water and may fall into that bucket. So due to the small size, if they are falling into the bucket, that may end up with the near drowning. So in order for that, we have to educate regarding these health problems of the infants to the caregivers, and be conscious and have a careful watching and continuous watching on the infant regarding this health problems. Next is needs of infant. So the baby will need for sucking, safety, emotional need, love and security from the primary caregiver, discipline leading to self-control, developing the self-esteem, nutritional need, that is as per RDA we have to give the nutrition, and urine output 1 ml per kg per day. Next is red flags in infant development, that is unable to sit alone by age of 9 months, unable to transfer the object from one hand to another hand by age of 1 year, abnormal pincer grip or grasp by 15 months, unable to walk alone by 18 months, failure to speak recognizable word by 2 years. So when you see these red flag signs in infant development, then we have to immediately notify to the pediatrician. Next, importance of studying growth and development, that is role of nurses. Like when we understand the behavior of the child, that is normal growth and development, then only we can identify if the baby is being deviating from the normal pattern or not. And also then only as a nurses we will know the what behavior exactly we have to get it from the child or not. Then when nurses knows only, they can impart the knowledge to the caregivers regarding the normal growth and development pattern, normal milestone pattern, normal fine motor and gross motor pattern, and when does the weight get increases, and how to have a close monitoring of the height and weight, everything will be assessed. So growth and development is a very important aspect in close watching of the infancy period, because the infancy period is the period where they have a tremendous increase in their all the skills. So if you have any doubt, kindly drop down in the comment box. Thank you for watching, and subscribe and watch it.